Are you considering dental implants? If so, you're likely feeling a mix of hope and anxiety. Hope for a permanent solution to a missing tooth, but anxiety about the pain, the cost, and the terrifying question, what if it doesn't work? You've probably been told that implants are the gold standard, a simple and routine procedure. But there's a side to the story that is often glossed over in the dental chair, a set of truths that are not very profitable to discuss. I'm talking about the realities of the healing process, the real reasons why implants can fail, and the specific details you must understand before you commit to this life-changing procedure. Today, we are pulling back the curtain. This is not a sales pitch. This is the honest, unfiltered guide to dental implants that you need. We will cover everything from the unspoken truths about swelling and rejection to the contraindications that could make implants a dangerous choice for you. The information in this video is designed to empower you to ask the right questions and make the best possible decision for your health. What really is a dental implant? Let's start with the basics, but with the detail you deserve. A dental implant is, quite simply, an artificial tooth root. It's a small, screw-like post that is surgically placed directly into your jawbone. The vast majority of implants are made from a biocompatible titanium alloy, the same material used in hip and knee replacements. Your body recognizes it not as a foreign invader, but as something it can bond with. This bonding process is the absolute magic of dental implants. It's a biological phenomenon called osseointegration. Think of it like a tree putting down roots into the soil. Over a period of several months, your living bone cells, called osteocytes, literally grow into and fuse with the microscopic threads of the titanium implant, creating an incredibly strong and stable foundation. This is what makes an implant feel and function just like a natural tooth. After this fusion is complete, a connector, called an abutment, is attached to the implant. And finally, a custom-made crown, which is the part that looks like a tooth, is placed on top of the abutment. It's a three-part system: the implant, the root, the abutment, the connector, and the crown, the tooth. Understanding this is key to understanding both the timeline and the cost, which we'll cover shortly. While titanium is the standard, it's also important to know about zirconia implants. These are a ceramic, metal-free alternative that are sometimes used for patients with a rare titanium allergy or for aesthetic reasons in the front of the mouth. The unspoken truth about the healing process. This is one of the most important things you need to understand. Getting a dental implant is not a one-day affair. There is a significant and non-negotiable healing period. For a healthy individual, the osseointegration process we just discussed takes, on average, 2 to 3 months for the lower jaw and 4 to 6 months for the upper jaw, which has softer bone. During this entire time, you will likely be without a tooth in that space. While a temporary solution like a plastic flipper or a temporary bridge might be possible in some aesthetic zones, you must be mentally prepared for a period of healing with a gap. Let's talk about the immediate recovery. After the implant is placed, swelling is not just possible. It is a normal and expected part of the healing process. The swelling of your gums and surrounding tissues will typically peak on the 3rd day and then gradually subside. In fact, a good amount of swelling and even some bruising is often a sign of a robust inflammatory response, which is your body's way of sending healing cells to the area. You can manage this with cold packs and by following your surgeon's instructions, but do not be alarmed by it. Pain is usually minimal and well managed with over-the-counter pain relievers, but the swelling can be visually dramatic. The topic dentists hate: implant rejection. Now, let's talk about the fear that everyone has. What if the implant doesn't take? This is often called implant rejection, but that term is a bit misleading. It's not like an organ rejection. It's a failure of osseointegration, meaning the bone fails to fuse with the implant. The success rate for dental implants is incredibly high, typically between 98% and 99.8%, but failures do happen, and you need to know why. The number one cause of early implant failure is smoking. The chemicals in cigarette smoke constrict blood vessels, starving the healing bone of the oxygen and nutrients it needs to integrate with the implant. If you are a smoker, your risk of failure is significantly higher. The second major cause is uncontrolled pre-existing health conditions. Uncompensated diabetes, for example, where blood sugar levels are consistently high, impairs the body's healing ability and can prevent proper integration. The third reason can simply be individual body characteristics. In very rare cases, a patient may have an intolerance to the titanium alloy, or the quality of their bone may be too poor to support the implant. So, what happens if it fails? The good news is, it's not the end of the road. The failed implant can be easily and painlessly removed. In some cases, a new, slightly larger implant can be placed immediately. In other cases, the surgeon may clean out the area, place a bone graft to strengthen the site, and allow it to heal for 3 to 6 months before attempting a new implant placement. While it is a setback, it is almost always a correctable problem. Demystifying the cost. The cost of a dental implant can be intimidating, and the payment structure is something that is often not clearly explained up front. It's crucial to understand that you are not paying for a single procedure. You are paying for a multi-stage process over several months. Typically, the total cost will be broken down into 3 separate payments. The first payment is for the surgical placement of the implant itself, the artificial root. This covers the cost of the surgeon's time, the sterile equipment, and the implant itself. The second payment usually comes 2 to 6 months later, after the implant has fully integrated with your bone. This payment is for the placement of the abutment, the small connector piece, and the third and final payment is for the fabrication and placement of the final crown, the part that looks and functions like a tooth. Understanding this staged payment process is essential for financial planning and for managing your expectations about the timeline of the entire procedure. The life-changing advantages. They don't emphasize enough. Now let's talk about why. Despite the healing time and cost, implants are considered the absolute gold standard. The most important advantage is the preservation of your neighboring teeth. Before implants, the only way to replace a single missing tooth was with a traditional bridge. This required grinding down 2 perfectly healthy teeth on either side of the gap to act as anchors. This is an aggressive and irreversible procedure that damages healthy tooth structure. An implant is a self-contained unit that replaces the missing tooth without harming any of the adjacent teeth. The second major advantage is the prevention of bone atrophy. When you lose a tooth, the jawbone in that area is no longer receiving the stimulation of chewing forces. Your body, being incredibly efficient, interprets this lack of use as a sign that the bone is no longer needed, and it begins to resorb or melt away. This bone loss can lead to a sunken, collapsed look in your face, making you appear much older. Because an implant fuses with the bone and reintroduces those chewing forces, it tricks your body into thinking the natural tooth is still there, thereby preserving your bone and your facial structure. This is a benefit that you will appreciate for decades to come. The absolute contraindications. Finally, it is my responsibility to tell you who should absolutely not get dental implants, or at least needs to have a very serious discussion with their medical team. There are a few absolute contraindications. First, uncontrolled, uncompensated diabetes. If your blood sugar is not well managed with medication, your body's ability to heal is severely compromised, and the risk of infection and implant failure is too high. Second, active cancer treatment. Patients who are currently undergoing chemotherapy or radiation, or are under the care of an oncologist, are generally not candidates. Third, and this is a critical one, patients taking bisphosphonate medications. These drugs, often used to treat osteoporosis, can in rare cases lead to a serious complication called osteonecrosis of the jaw, where the bone fails to heal. And finally, severe immunodeficiency conditions like AIDS. For these individuals, the risk of post-operative infection is simply too great. The decision to get a dental implant is a significant one, but it doesn't have to be a frightening one. By understanding the truth about the process, the healing, the risks, and the incredible benefits, you are no longer a passive patient. You are an informed partner in your own healthcare. You now have the knowledge to ask the right questions, manage your expectations, and make a decision that is truly right for you. Thank you for trusting me with your time today. If this video has given you the clarity and confidence you were looking for, please hit that like button and subscribe for more honest health insights. And now, I want to hear from you. What is the biggest question or fear you still have about dental implants? Ask it in the comments below, and let's continue the conversation.